Awesome. Yeah, thanks everyone. Thanks PHN for having me here. So yeah, I'm Cam. I'm one of the founders of Lyngo, and at Lyngo, we're creating AI receptionists for healthcare clinics. Next slide. Thanks, Pete. So before I dive into what is an AI receptionist, I wanted to sort of explain a little bit as to why we decided to go into this space. So I'm an engineer, I'm a technologist, and I was working with a friend who's now my co-founder, my business partner, and we were exploring some new technology, some of the new AI technology that had come out, and we were really just sort of digging around looking for, okay, where is some problems, some old problems that we could solve potentially with this new technology. And we're really interested in the voice space because I think that's a really, unique way that humans connect to one another. They connect via voice as their primary, generally their primary communication. So we were thinking, okay, this new technology could really unlock and really help a lot of people in different areas. So we just went broad and we started talking to people from a whole bunch of different industries. So from barbershops to golf courses to veterinarians and hospitality. Everyone few and far between. We had a chat about it to sort of understand, I guess, how they workflow, what they did day to day to see if there's a problem that we could solve. And then we came across an interesting piece that got put out by Clinico. I think a lot of you will be familiar with Clinico. They're one of the larger practice management systems in allied health. And they released a report around some statistics of allied health professionals in Australia. And they said the average clinic had about 3.3 practitioners. And generally employed 2 admin staff to support those practitioners. So we thought that was quite interesting, quite a high sort of admin to practitioner ratio for these clinics. So we started to talk to these clinics. We went and talked to a whole bunch of them, hundreds of them actually, and actually went and sat into their clinics and became drop-in receptionists to really understand what their workflows were. And what we found is that a lot of them were missing a huge amount of phone calls. So some we're talking to are missing, more than 50% of the calls that were coming through because they were busy with patients or busy with other things, which was leading to, really large amount of missed opportunity daily that was coming through for potential patients that were trying to make appointments. And some clinics were really busy on the phone. Some that might not have adopted, some of the online booking platforms and things like that had quite a lot of people that were calling in. They were spending, more than 4 hours on the phone. And we kind of found this across, a whole bunch of different allied health disciplines, physios, podiatrists, osteos, chiros. So we thought, okay, we want to try and solve some of these problems that they're having. So duck to the next slide, Pete. So the way we do that, our primary product that we have is an AI voice receptionist for allied health clinics. So what we do is we pick up the phone for your clinic. A normal person will call the number they find on Google. Instead of going through to your reception or your practitioners, it comes through to our AI. We interact with the human just like the call interacts with our system just like they would with a human. We answer sort of general FAQs. Do you have parking? Can I bring my kids along? But what's really unique is that we integrate into our clinic's booking systems, so Clinical and soon Nucal and a few of the other ones, such that we can, manage appointments. So we can book new appointments for new patients and existing patients. We can reschedule, cancel, and do majority of those things that people call about. As well as a few different features around escalating and taking notes and providing some insights and some data around what people are calling about and those sorts of things. So next slide, Pete. So a little bit about myself. I actually grew up in Tamworth, which I believe is part of this PHN network. It's quite a large network, this one. And then moved to Newcastle to study engineering. So I studied mechatronics engineering. I've predominantly worked most of my career in vision AI applications. So things from detecting burnt nuggets for burnt chicken nuggets for Maccas through to detecting defects on brand new cars coming out to detecting early fires in mining and recycling plants and things like that. So basically using cameras to automate processes and to do a lot of things around safety particularly. So I worked for a few local companies and then a couple of Sydney companies, but then sort of most recently I worked for an online STI health telehealth clinic. and really got an insight into how some of the rails work in healthcare, and how some of those back end pieces sort of fit together. All right, next slide, Pete. So I wanted to talk a little bit about today around, some different things you can use AI for. And when I talk to people around this, what I find really useful is understanding, what they're actually using in their day to day. There's kind of, AI for everything now, and it's really quite overwhelming. And what I've noticed with talking with people is that there's actually just a lot of stuff that they didn't realize that they could do with just the AI tools that they're currently using, for example, ChatGPT. So I just wanted to just go through a couple of things that I use it for, and then hopefully that might, something might tick in your brain where you might be able to think, oh, maybe that's something that would be useful for me as well. So first and foremost, AI is really good at software development. I write a lot of code in my day-to-day life. I know that might not be applicable to most of the audience here, but I'll touch on later why that's actually really important for you all to know that. Another thing that I really use it for is like a sparring partner in our business. So, I do have co-founder and a team, but sometimes, if I'm trying to think about different strategies or different ideas or maybe different ways to even handle how to interact with staff members, or some really tricky customers that we might have, having like a back and forth, almost like a therapist almost, to sort of help me talk through and kind of like verbalize my thoughts. And that's just, purely through ChatGPT as well, generally. Another one is a new feature that's come out with a few of these sort of online tools like, Claude and ChatGPT and Gemini, the main ones, is the ability to do deep research. And I find this really useful because it's this tool where you can basically, ask AI, hey, can you go and find out, for example, who are the top 5 AI companies in, that are doing scribes, for example, in Australia. And it'll ask you a bunch of questions about what your criteria is, and it'll actually go off for about 20 or 30 minutes and crawl through the web, look through different independent reviews and come back and actually generate a report. So I use that from all sorts of things, from investigating potential competitors to looking at new tools that I can use, but also just general things like finding out, most recently looking for things around. I've got a new child, so different cots and things like that. Just instead of me going in Google and trying to find which one's the best one to use and baby monitors, just get AI to go and do that for me and generate a report. So it saves quite a lot of time in my day to day. A few stuff I use it for in my personal life. So anything where it's like a high cognitive load for me to try and think about these things. If you've got like a family member that has is really tough to come up with birthday presents, I use it quite often for that. Putting their interest, their age, those sorts of things. And actually I use it quite a lot for recipes as well, planning out my week. I get it to generate a bunch of recipes with what I might have in the cupboard or in the fridge. And doing things like, using that deep research to find out, is there a better way, is there cheaper, house insurance or car insurance that I can use? And it's quite useful for that. Interesting one is midwife and therapist. So you've got to use this very sparingly here. You don't want to take clinical advice from AI, but I've got a 2-month-old, my first child. And what we found really useful is in ChatGPT, there's a voice mode where you can talk back and forth. And when you've got your hands full with the baby and the baby's been screaming for, say, 12 hours and you're not sure what's going on, just to get some reassurance to be like, hey, I've done this, I've done that. Like, is there any, do you have any other ideas to help me try and settle this baby? And it's trying to figure out what's normal and what's not normal. And it's really just sort of like a back and forth and actually kind of like a support person that says, hey, you're doing everything right. Like, it's okay, hang in there. But what was really interesting actually is that it was really fundamental in supporting my wife's breastfeeding journey. So, she used that in conjunction with lactation consultants, but it gave some really just good tips around different things you could try that, was a really positive outcome. Another bit of a side one is, plant and lawn care. If the models now can take in images and videos even, so if I've got, some bugs eating my plants or some things going on with my lawn, which, since the rain lately has been pretty chaotic anyway. But before that, it's actually pretty good at diagnosing a few of those things and, helping you, do sort of general day-to-day chores. All right, next slide. Hey. So, there's AI for this, AI for that, and a lot of noise around this space, and it can be quite overwhelming. Even for me, that's in this space, there's just so many tools out there. You can't try them all, and it's really hard to sort of figure out, should I be using AI for this or shouldn't I? So what I sort of wanted to touch on was, where's the best sort of use case for AI? And generally, you want to. Sorry, 1 second. I'm just going to close my window. Dogs are barking out there. You generally want, where AI is really useful, this new wave of AI, LLMs, is something that's repetitive but also needs a bit of a personal touch. So if you have something in your business, in your workplace where that happens quite frequently, maybe daily or weekly, there's generally some rules around it. If someone makes an appointment, then I want to do this, I want to send this, and something that you might often delegate to someone else could be a really good place where AI can sort of kick in. Some of the caveats to that is, if you're doing something, for example, like a simple appointment reminder, you want to send someone an SMS, do you really need AI for that? Does it need to be super personalized? There's a lot of off-the-shelf, just general software tools, which might be a better fit because, there is downsides to AI as well in terms of reliabilities. This word a lot of people say is hallucinations, where it just might not say the right thing all the time. The other side of that is, needing a personal touch. So if it's repetitive and it also needs some sort of personalization, if you're interacting with, a patient, maybe potentially describing some results to them, or it's a patient-facing sort of thing, or somewhat emotionally sensitive, it can really help out with, taking in context of the situation. And providing a result that can kind of help get your thoughts out into a really productive way. All right, next slide, Pete. So I thought I'd go through a bit of a process around how to choose a tool. So let's say, okay, you want to start implementing AI in your workplace, and again, overwhelming amount of different solutions out there. So I recently went down to the Digital Health Festival last week or week before, can't remember now, in Melbourne. A lot of the PHN team were there, and a really big turnout for that exhibition was scribes. I think there was over 10 or 15 different scribes which take patient notes for you. So I'm sure if you're a clinic and you're looking to implement a scribe, it must be, again, quite overwhelming to figure out which one's the right one for me. So there's a few things you can kind of go through that might sort of help maybe clear that in your mind a little bit. The first one is really defining the problem. So, what exactly is your biggest pain point? When we talk to people, with our voice solution, they say, oh, it'd be great if we could do this, and maybe, can call people and all those different things. And that's great, but, let's just try and refine that down to, okay, what are you spending majority of your time on? Is it inbound calls? Is it outbound calls? For our particular use case, what is the main problem that you have? And then also, determining if it's admin, if it's patient facing, is it marketing, exactly what that problem is that you're trying to automate and solve. Second one is to validate that use case. So sort of, looking at that Venn diagram from before around, is it repetitive? Is there some sort of rules to it? You don't want to let AI go fully rogue and just sort of, sort of say, hey, go and take over this whole process for me, because if it hasn't got the right context, again, it can make errors. So you want some sort of rules that it can follow and some constraints you can put around it, such that it can perform its task really well. And again, do you actually really need AI for this? A lot of people are throwing AI into everything. Is this a tool where AI is useful, or would a simpler tool work? For us, to be able to do this sort of AI voice conversations that we do, AI was a real unlock of technology for that to happen. It was almost impossible to do that previously, at least for a price point for small clinics that we were targeting. So, really understanding if AI is the right way to go about solving that problem. The next step is to, okay, you validate that use case. Okay, you've looked at a few different providers, and you think, okay, this one seems to be more tailored for my type of clinic or my type of business, and I think I want to try out maybe one or two of these. A good idea is just to start small. If you have a business or has multiple locations, maybe start with one location. Something that we do with customers is if they might just turn on their AI phone answering after hours, for example, or maybe during lunch breaks or when their receptionist isn't there. We make some tweaks if we need to until they sort of gain the confidence, and we make sure that we collect all the information that we need in order to, answer questions appropriately. So really try and start small and try and see if you can get that one thing to work. I guess this probably happens before step 3. I've probably got in the wrong order here, but really sort of look at the security aspect of this. So this is kind of touching on this AI software development I was touching on earlier, where because AI is getting really good at writing code, what we found is that there's quite a lot of people out there now, and they have a term for them called vibe coders, where they will, non-technical people will be creating these new tools, these new apps, but they have no understanding of what the actual software is. And what that leads to is an insecure application that doesn't actually fit the best practices in terms of general cybersecurity, purely because they don't understand exactly what they're doing. They can tell an AI, add a new button here, do this thing, but they haven't got the knowledge to be able to make sure that it's secure. So as a potentially non-technical person, how do you know if a product or a company or an app is secure? Making sure that they've got the right compliance. Do they follow sort of general security guidelines? Do they have like different certificates that they can show? But I think another one that's more that I really like to do is actually look at the team. So most companies will have like on their website a teams page there, and sort of look at one, the size of the team, but also who's in there. Do they have actual engineers, or are they all they all non-technical people building this? Because that might be a bit concerning if there's no one that is technical, particularly for any tools that are touching anything really, really sensitive. So, for example, our tool integrates with your booking system, which means it has access to patient data. So we take that very seriously. A lot of people in this space do take that very seriously. But if something went wrong, there's a huge risk for your business. So that sort of comes into number 5 is, what's the risk if this fails? What if something goes wrong? Could you potentially lead to your patient data? What are the scenarios that could go wrong with this, and what are the benefits that could come from this? So really sort of analysing that and understanding that, and asking the appropriate questions when you maybe chat with different people from these companies that are building these tools around, okay, what sort of protections do you have in place to ensure this won't happen, so my business won't be affected if something happens on your side, and really gaining that confidence. Next slide, Pete. Cool. So I just want to do a quick Slido on what worries you most about implementing AI into your business. This is more so for me to kind of get a general understanding, but I think it'd be interesting to see what are people thinking about when they're implementing digital change or implementing AI, and maybe we can touch on that. Not sure if I can see the results there though. Oh, there we go. Cool. It's coming up on my screen. Wonderful. Compliance, legal risk is a big one. That's good. Getting it wrong, errors and misinformation. Yep, that's really valid. It's great to hear that a lot of people are thinking about the compliance thing. We've unfortunately come across a few competitors or other people in this space, even if they're not direct competitors, and knowing people that have worked with them and what they do under the hood is quite concerning with some of the processes that these some people are implementing. So having that as a front of mind, I think, is really good. Getting it wrong. So, a big, people always sort of mention this term hallucinations in AI, and that can come in many forms. Generally, when people talk about hallucinations, it might be, okay, if you go and ask ChatGPT what's 10 plus 10 and it tells you the wrong answer, that would be a hallucination. But in in our setting, for example, if someone made a booking went to make a booking for myself, but it made a booking for another patient, then that would also be a hallucination. So it's actually like a bit of a larger error in that case. So it's definitely worth sort of talking about that sort of terminology with these companies. poor patient experience is really interesting as well. Making sure that this is actually going to be a better result and not create more problems. Too hard to implement. Yep, that's definitely a fear that we see. And yeah, lack of trust there. So that's an interesting one. Yeah, all very valid. And I'm happy to chat with anyone around any of these tools or anything around this space. I'm actually really excited about this space. So if you go to the next slide, Pete, you can get my contact details. But yeah, feel free to shoot me a message, catch up. Unfortunately, we couldn't catch up in person today, but that's my LinkedIn there. That's my co-founder, Tam May's LinkedIn as well. You can have a look at our website or flick through any questions that you have.